I became aware of an advance directive after I got seriously ill and landed in the hospital. Before then, I had just never thought about writing down my wishes for what kind of treatment I want or I didn't want, in case I became so seriously ill that I couldn't speak for myself. I'd never really had a serious illness before, and I never thought about having an advance directive. Thankfully, my heart is much better now, and even though I'm feeling better, I still have a family, and that's why I have an advance directive.
I too have recently revised my advance directive. I'm thankfully not seriously ill, but I have an advance directive because I have a family who I know will wrestle with decisions about my treatment if I become suddenly seriously injured or ill. I can't stop that, nor would I want to. Who else would know me better? But I have an advance directive to give them clear authority to speak for me, and perhaps to tell them what I think I would want to lift a little bit of the burden from their shoulders. I have an advance directive for their sake because I care about my family. I have an advance directive because I am a dad. Advance directives can be simple or detailed. You can have your signature witnessed by 2 individuals, or you can choose to have it notarized. Advance directives better enable doctors to treat patients in ways that are consistent with their wishes, with what matters most to them. If you have an advance directive and find that your situation or your preferences have changed, it's easy to update it, to revise it. If you do have an advance directive, I strongly suggest that you share a copy with the people you know and trust, certainly with the person you have named to speak for you if you're unable to speak for yourself.
I used to think that I'd just let my wife or children make medical decisions for me if I ever got to the point that I wouldn't be able to speak on my own. But I decided that would put my loved ones in a very stressful position. It could also put them in a position to make decisions on my health care that I might not want. It's important to have conversations with your loved ones about your advance directive and what they might want to do in case something traumatic happens. Advance directives can help your family follow your wishes. My illness was my wake-up call to have an advance directive, but don't wait. You need to complete and submit an advance directive while you're healthy and have your wits about you. It's not something you should put off.